So if you're a carer, you're a senior carer, whether you're already in the UK or not, or you're somebody who is considering ever studying nursing in the UK, then you must watch this video till the very end, because I'm going to be telling you the best pathway currently to become a nurse in the UK without spending a penny of yours. In fact, with this pathway, you're going to be paid and well paid to study nursing in the UK. So you want to make sure that you've got a book, you've got, or you've got something to take notes. Basically, you need to be able to take notes, because this is going to be full of value. This is going to be, I don't want this to be just another YouTube video you're watching. I want you to implement this. So please leave a comment below saying, Melvis, I will implement, so that I can hold you accountable. I can chase you up and say, look, you promised that you were going to implement this. What have you done so far? So now let's get into it. So this particular pathway, like I say, many people don't know about it, but it is currently the best pathway towards nursing in the UK without having to spend a kobo. So basically, it's called the nursing associate. So who is a nursing associate? What is a nursing associate? What do you do? I'm going to be covering in this video who a nursing associate is, what regulation they have, what requirements you need, and how you become a nursing associate, as well as obviously how much you earn, and how you can progress into nursing from a nursing associate. Again, just to set the tone straight, you don't have to progress into nursing if you're a nursing associate. So to put things into perspective, in the UK, obviously you've got carers. So between a carer and a qualified nurse, you have quite a few different roles. So you've got a carer, that is normally band 2 on the NHS agenda for change when it comes to pay. So carers generally earn, the starting salary is 20,000 and the maximum salary obviously is £21,000 so per year. After a carer, the next senior position that you've got is a senior carer. So when you're a senior carer, you're earning, your starting salary is £21,000 per year, and then you can develop into £23,000 per year as you progress within your senior carer role. Between the senior carer role and a qualified nurse, there is this role that I'm talking about, the nursing associate. So the nursing associate, obviously, in terms of pay, you're earning band 4 on the NHS agenda for change. So the starting salary for this is £23,000 and you grow into about £26,000. But like I say, the main thing that makes this role very fascinating is not only about how much you can earn, it's not the fact that it is the most senior position for carers, carers as in the junior nursing roles, but is the fact that it can lead you, is the quickest way for you to progress into nursing. So what do I mean by this? The NMC, which is the Nursing and Midwifery Council in the UK, they regulate nurses and midwives. So the NMC in 2019 announced that they were going to be regulating a new role called the Nursing Associate. So if you look from 2019 till now, it's not been a very long time since this role has been in existence. It only existed a few years before the NMC decided they were going to regulate this role. So again, to put things into context, prior to 2019, there used to be a role called the assistant practitioner role. So the assistant practitioner role, basically some trusts realized that they could train carers and healthcare assistants to carry out more advanced roles. So what they did was they started a training in like university, which was 2 years for carers so that they could progress, because it's not every carer that needs to progress into nursing. So it's but fair that carers also have their own career progression pathway, and that is how this assistant practitioner role really came about. So they had these courses in universities where carers could do for 2 years to become an assistant practitioner. And assistant practitioners could do things like ECGs, they could do bloods, they could do cannulas, these sorts of advanced roles. One most important thing that assistant practitioners could do was that they could take their own group of patients independently, but under supervision of a qualified nurse still. And this is because assistant practitioners were not allowed to administer medications, whether oral or IV. They were not allowed to administer any medications whatsoever. And so, even though this role was paid at band 4 and carers generally are paid at band 2, some employers began to think like, oh, actually, We can just train our carers in-house to do ECGs, do bloods, do cannulas, and all these skills without them necessarily going to university for 2 years and becoming assistant practitioners. And by so doing, for an employer, it is quite it is quite a good thing because then they're going to save on cost. Obviously, not very good for the staff, but it's quite cost effective as an employer because you're going to take somebody who is a carer, band two, for example, train them to do all these advanced skills. Maybe you don't even pay them more. So depending on where you're working in the UK, it's going to influence the opportunities that you have. And that's why I always go on about the importance of working for the right employer. Because in case you're wondering, by the way, you're new to the channel, it's beautiful to have you. If you haven't subscribed, do hit subscribe, turn on the notification button because you want to be the first to be notified when I drop a new video. If you're a returning subscriber, it's always a pleasure. I'm incredibly grateful that you keep watching these videos, you keep leaving your comments. And I'll get to the comments when I can. I know that sometimes people complain, oh, Melvis, you haven't reply to my comments, but I'll get to them when I can. So in case as well you're wondering who I am, so my name is Melvis. I work for the NHS as an advanced nurse practitioner, so I've progressed quite well within my nursing career. I started in 2011 as an international student. I was also working as a band 1 carer at the time, so I've been able to grow from band 1 to an 8B position, which is quite a good, it's taking a lot of hard work. It's taking a lot of hard work, a lot of mentorship for me. I really appreciate my mentors. I don't really joke when it comes to mentorship because this is something that I have benefited a lot from. I continue to benefit from mentorship, from various colleagues, who are doctors, pharmacists, nurses, within the profession. So, thank you all for that. And I have my own career coaching program where I support nurses, carer, student nurses with career progression in the UK. Because like I say, for me, it's not enough that you're a carer now. It's not enough that you're a nurse. But what next? What is the next stage? What do you want to do with yourself now that you've gotten to this level? There's always more that can be done. And that's my belief. And so that's where I like to lead, and work with the people that are part of my private coaching program to get them to this stage. Yes. If you're thinking of becoming a nurse lecturer, yes, that may be your dream, or nurse anesthetist, nurse endoscopist, a specialist nurse. That may seem like a far-fetched dream, but if you have somebody like myself that can support you through that journey, then that can start to come to life, really, because of that accountability. Because if you're alone, it's just like, oh, how do I get the information? How do I do it? Because look, your employer is not going to tell you. Let me tell you that, because they will rather have you in the position where you are right now rather than get you to progress. Because when you progress, you leave. That's how it is. And that's why many employers are not willing to support staff to progress, because when you progress, you're going to leave. That's how it is. So, you want to make sure that you're checking out the description box below. Consider joining my coaching program so that I can support you through your journey. If you're also thinking of becoming a nursing associate, which is what this video is all about, I can support you with that. I do have members of my coaching program currently who are nursing associates, some who are transitioning into nursing. So you will have access to those people as well. And they'll also share their own experiences with you. Which is something that is really incredible, which is a support system and a support network that you want to have in the UK. Because look, career progression in this country is not easy. Over 70%, over 80% of nurses and carers are never going to progress from that one position, which means if you're a band 2 carer right now, the likelihood that you're not going to progress from that position is very, very high until you retire at the age of 67. I don't want that to happen to you. I don't think that's fair. The pay is poor. I don't think that that's okay. I think that you deserve to thrive in your career. And so that's why I'm passionate about it. So back to our nursing associate program. So basically, like I was saying, the assistant practitioner role was found that obviously these people were being paid at band 4, but yet the role was not very different from that of a carer because they couldn't administer medications. And so somebody was really smart and wise to come up with a nursing associate role. So that's how this role came about. Somebody sat down and said, oh, look, why don't we up this training? Why don't we train somebody that can be able to administer medications, as a qualified nurse, but actually that person, we're going to restrict their practice somehow so that they are not able to administer intravenous medications. And that is when the role of the nursing associate was born. Like I say, the NMC started regulating this role in 2019. Currently, on the NMC register, there are about 7,000 nursing associates currently practicing. So if you're a nursing associate, yes, you're registered with the NMC. You need to have an NMC PIN number. Not only that, you need to do revalidation. Not only that, you need to pay £120 per year to maintain your name on that register. And one very important thing also is that you can go through fitness to practice. So currently in England, carers are unregulated. So if you're a carer or senior carer, it's an unregulated profession, which means that there's no professional body for you to register to call yourself a carer in England. But if you're a nursing associate, you must, for you to call yourself a nursing associate, you've got to be registered with the NMC and have an NMC PIN number. So that is a very big difference. And also, nursing associates are paid at band 4. So band 4, like I said, you start earning from 23,000 and you grow till about 26,000 pounds, because then is that career progression towards being a qualified nurse. So we're going to talk about how do you become a nursing associate in the UK. So you're already in the UK right now. What do you need to do today or in your journey to become a nursing associate? So again, if you haven't subscribed to the channel, do make sure that you hit subscribe, turn on that notification button, because if you're enjoying this content, also leave a comment, say Melvis, I will implement. By liking the video, it makes me know that you're enjoying such content, and I'll do more videos about things like this that can help you, can support you through your journey. So how do you become a nursing associate? The first thing that you need to do is you need to get on a course. So unlike a carer where anybody can become a carer, a nursing associate, you've got to complete a course which is 2 years in duration. Not only do you have to complete a course, but it has to be a course that is accredited by the NMC. So it's got to be, the NMC has a list of institutions or of providers that are eligible to provide this particular nursing associate course. So you've got to study with one of those people. That's the first condition to becoming a nursing associate if you are in the UK. So even if you're still out of the UK now, or relatives, or anybody who wants to become a nurse, this is a pathway. You need to share this with them, please, because it's going to be life-changing. And if you know that tuition fees in the UK are pretty expensive, to be able to study for free and be paid while studying, is just incredible. So the first condition, like we've said, is that you need to study in a place that is accredited by the NMC. That's the first thing. Then the thing is, how do you get to study? That's what you may be thinking. How do you find out these institutions? What you need to do is you need to look out for when the jobs are advertised. So they're always advertised as trainee nursing associate positions. So, and this is where, again, having a good employer really, really plays a big role. Because I know when I go on about the importance of thinking about career progression, the importance of getting an employer that can support you with career growth, some people are like, oh yeah, we just need somebody that's going to pay me more now, but it doesn't work. Because if you're working for the NHS, for example, then you have access to this training, compared to if you're working, say, for private employers, or you're working in a nursing home, or you're doing domiciliary care. Because when it comes to funding for this course, like who is paying? Because you're not paying. And if you're not paying as a student, someone else is paying for you. So Health Education England is the one that pays for this course because it's an apprenticeship program. So Health Education England pays, but as an individual, you can't just go to Health Education England and say, oh, by the way, Health Education England, I want to do the course. Can you pay for me? No. How you access this money from Health Education England is by going through a provider that has access to get this money from Health Education England. And in this case, the NHS is the best, is the best employer to work for. So if you work for the NHS, they will normally recruit. So if you're on a particular ward, for example, talking about criteria to do the course. So if you're working on a ward and they're doing, say, nursing associate recruitment, there's going to be rules that are set by that ward. For example, they may say, for us to train you to become a nursing associate, you're supposed to have worked with us for at least 2 years. If that is a rule, if that is a law where you're working, then that's how it's going to be. You're supposed to work there for at least 2 years, as a carer before they can train you. And what normally happens is that if you're a healthcare assistant, for example, or a carer, that's normally band 2, so you'll be earning 20,000 per year. If you're accepted onto the nursing associate training program, you then get paid band 3. So that's a senior carer pay, which is 21,000. But most importantly, once you complete your course in 2 years, then you move up to band 4. So the conditions are you need to have an employer that is able to fund you to do this course. But not only that, you also have to meet the specific criteria of that ward, of that employer that is funding for you to do the course. And there's also something that you need to know about this rule. If somebody is funding you, they're paying for you to do a course, they need to get something back. They need to be thinking, look, if I'm a manager, I'm working, I run an NHS ward or nursing home, wherever, and I'm paying for you to do a course that is going to make you, give you that ability to become a qualified nurse, I may be thinking to myself, but what have I got to gain from this? What if Melvis studies for this course and then she decides to leave us? How am I protected? Yet I've been able to access this funding and Melvis has studied through this funding. What do I gain? And this is where more clauses come in. So what the employers would normally do is they'll say to you, look, you need to sign a study leave form. So with that study leave form, when you're signing it, they'll say to you, you can't leave us for at least 2 years once you qualify. It's a very common thing. Even for me currently, I'm doing my master's in advanced clinical practice, which is it's like a crash course to medicine. The master's is 3 years. It's for senior healthcare professionals. So with that master's is funded by Health Education England, but I'm doing it through the NHS. So I've had to also sign to my employer to say, look, when I complete this master's, I'm going to work with you for at least 2 years. If I don't, you can charge me back to pay this money. So that's what happens. If you're a nursing associate, because you're not paying, your employer is paying. So you need to give them your word to say when you successfully complete the training, you're going to work with them for at least 2 years, just so that you're offering that service, which is vital, because otherwise you wouldn't be training a nursing associate if you didn't need one. So again, that shouldn't be something that you've got any issue signing, because having to study and pay for it yourself is pretty expensive. Nursing is over £9,000 per year. So the fact that they're paying for you to do this course, is worth signing, those forms. Like I said, I've signed one myself, because having this funding to do this course is way more important for me than the fact that I'm going to have to work two extra years or 2 years on successful completion. So that's one of the conditions as well. Another condition to do the nursing associate program is that you need to have GCSE Maths and English, because with nursing, it's a pathway that kind of leads you into nursing, but without having to pay. So you need to make sure you've got GCSE Maths and English. If you're from overseas, if you did your GCSE overseas, please, you need to check the equivalent of GCSE, what is called in your country. I'm not sure what it's called, but I'm originally from Cameroon and it's called GCE. In Nigeria, I don't know if it's WAEC, but it's all different names. So you need to check in your country what it's called. We normally do that exam when we're about 15 or 16. So you need to have Maths and English GCSE. In case you don't have it and you're thinking, oh my goodness, I did this like 25 years ago, I don't even know whether I had Maths and English, you don't need to worry, because you can do it in the UK. So you can so this is the equivalent. If you don't have GCSE Maths and English, you can use either GCSE from England, so you can go back to school and do GCSE Maths and English. That's an option. It's 1 year in a college. Just check the nearest college to where you live, and they'll be able to support you how to do GCSE Maths and English. So that's one option, because depending on where you live in England or in the UK, it's going to influence what facilities you have. And again, that's why I always say that if you're living in a good place, you have access to better facilities. So if you're watching this and you're still out of the UK, choosing a place to live based on the facilities is very important, rather than which place is cheaper, which place is more expensive, because people tend to focus a lot on the costs, as saying, oh, I rent cheaper, but actually certain areas are more expensive, not because they're expensive for nothing, but it's because you have better facilities. So you need to be really careful and strategic when you're choosing where to live in the UK, because it's going to influence what opportunities you've got, So again, If this is content that you like me to do more videos about things like this, the best places to live in the UK, which areas are offering the nursing associate courses, again, leave a comment below, like the video, let me know that you want that content, and then I'll do it for you. Because this nursing associate is not available everywhere. There are certain parts of the country that don't have this role. So you need to be in the right area, or you need to be flexible enough to move around for you to get access to do this. So there are quite a few sacrifices that need to be done. There's quite a few research as well that needs to be done. It's not just a straightforward thing, because you need to be really on top of your game. You need to be checking online, which places are offering these nursing associate programs. You need to be checking if you're working somewhere. The easiest way is just ask, look around. Are you seeing any nursing associates? Are you seeing any student nursing associates? If you're seeing nursing associates where you are working, then yes, it's a good place. It means that you can do it as well. But if there are no nursing associates at all, then it's like, what are the chances for you doing the nursing associate program in that place? Is very, very difficult, because if they don't have them, it's not going to be possible for you to become, something that is not even available where you are. So you need to make sure that when you're choosing where to work in the UK, it's not just about, you need to be looking for where there are the best opportunities, because the opportunities that you have up and down the country are different. It depends on where you choose to live. The geographical location where you are is going to influence and is going to determine how far you can progress. So you need to be keeping this in mind. If you're part of my coaching or mentorship program, obviously these are things that I will normally go through with you. Whether you're moving jobs or just looking for better opportunities, we'll normally go through depending on the role that you want, because different roles are different. We'll look the best areas in England or in the UK for you to be in order to access that training. So this is something that if you're not part of my program, obviously you need to be doing this. You need to be looking at those roles that you want. In this case, the nursing associate role. Look where it's available, and then see whether you can move there. You can commute. One of our members who is doing a nursing associate program, she's currently transitioning into nursing. She's actually had to commute from where she lives, commuting to another place, so that it could enable her to do the type of program into nursing. So again, talking about the requirements, if you don't have GCSE Maths and English, from your home country or from the UK, then obviously you need to go back to college, do GCSE Maths and English. Is 1 year. Or another option that you can do is functional skills level 2 Maths and English. So this is a really good tip. You want to write this down. Functional skills level 2 Maths and English. It will be accepted as an equivalent to GCSE Maths and English, which means that if you're already in the UK and you're working, obviously because you've got that healthcare experience, you can then use that experience to gain access to do these functional skills level 2 Maths and English. So again, depending on where you live, this course may not be available. It's not available everywhere in England or in the UK. You need to be in the right place for you to gain access. But again, you can still do it maybe like online through distant learning. So this is for you to check if you're interested in the role, to make sure that you are aware of a college that is offering this course and that you're eligible to enroll. Because again, for you to do functional skills level 2 Maths and English, there's a lot to do with funding, because anything that you're not paying for yourself, someone else has to pay. And a good way of doing this course is through your employer. Again, this is where working for the NHS makes such a huge difference, because the NHS normally funds healthcare assistants, carers, support workers to do functional skills, so that it can prepare them to get into nursing courses like this nursing associate program, or like just the normal nursing program. So again, you need to check this with your employer, obviously, because I don't know who you're working with or who you intend to work with, or whether you're employed or unemployed. So everybody's personal circumstances will be different. But again, if you're part of my private coaching program, then we can go through your own specific, circumstances to see what's best for you, because that's what we normally do, because there are so many variables, so many differences with these pathways, that it's impossible to just say this is what's going to work for everybody. And that's what makes career progression in nursing in the UK so complex, because it's not just a linear process. It's something that it depends on so many factors. Where do you live? What do you want to do? What are the working hours? Where do you work? In fact, in many NHS hospitals where this role exists, some wards don't even offer the program, which means that if you want to become a nursing associate, you have to move to a ward that offers the program, and it's very competitive as well to get through because you need to be seen to be proactive. Again, this is where being active within your workplace is very important because if you have all the requirements, you need your manager obviously to sign you off to do the program, which is so, so important. But if you're not working in an area where they have it, again, you need to keep an eye on jobs for trainee nursing associate apprenticeship programs because they normally advertise them. And sometimes I've actually seen, and supported people who have gotten, onto the program without working in that particular area. This now depends on how you're able to defend yourself and your knowledge during the interview. If you understand what the role is perfectly well, you know what is expected of you, then you're likely going to succeed even if you're not working in that area. But for you to get through with this, you need to know when the job is advertised, because if you don't know when the job is advertised, you can't even apply, which means if you don't apply, you don't have access to this opportunity. So it is an opportunity that is free. You don't have to pay. You're paid, to do it. But there's quite a lot of planning that you have to have in place to enable you access the role. And because competition is quite high, many people are interested because they know that they will become a nurse through this pathway without having to go through the normal pathway of paying. It's so, so good. And one advantage with this role, obviously, because you've watched till this moment, which I really appreciate. If you haven't subscribed, hit subscribe, turn on the notification button so that you're the first to be notified when I post such useful content about career progression in the UK. So, all these tips, all this information, I want you to implement it. I don't want you to just look at it and be like, oh yeah, that's what you said. Fine, well and good. So leave a comment in the comment section and say, Melvis, I will implement, so that I can hold you accountable. I can chase you up and say, look, you promised about this. What have you done about it? Also, if you like the type of content that I'm making, like the video, it just lets me know that the content is good and I can do more videos like this that can support you with your journey in the UK, so you can excel, you can thrive, you can be able to live your best life in this country, which you rightfully deserve. You deserve it because it's a job that you're of service to other people, so you need to get that gratification, you need to get that satisfaction out of it as well. So like we were saying, you need to be working on a ward that has nursing associates. If you're not, you need to find out. Then you need to have a good working relationship, because when they're choosing people, you want to choose. If I was a manager and I'm choosing somebody to be funded, I want to choose a member of staff who is proactive. I want to choose a member of staff that I know that is likely to succeed through the program. I want to choose somebody that I know that will represent the profession well, because the nursing associate role is regulated by the NMC, which means that, similar to nurses and midwives, if you're not behaving appropriately, there's a professional conduct. If you're not behaving appropriately, you can be referred to the NMC, and you have hearings and you can be sanctioned, which means that you can be sacked and struck off from the NMC register if you're not behaving appropriately, or if you're not upholding the reputation of the profession. And that is why it's being regulated by the NMC. Is because they want to kind of keep an eye on who is practicing as a nursing associate. So this is, these are obviously the requirements to become a nursing associate. So once you do the course for 2 years, the next thing that you then do is that you need to work as a qualified nursing associate for another 2 years. Oh, yes, you do. You have to work as a nursing associate for another 2 years. And then after that, if you want to then top up to nursing, there's a top up course for nursing associates. So if you do that top up course, it's again at university. Your employer again has to fund you to do that course. But not only that, you need to have worked for that employer for at least 2 years as a nursing associate. After 2 years, they can, if you're interested at becoming a nurse, they can then send you back to university to do a top-up program for 2 years, and then you become a qualified nurse. So when you complete your 2-year program that you do initially, you get registered with the NMC, you have a PIN number as a nursing associate, you then work as a nursing associate for 2 years. After that, you then go back to university and you do a top-up program, which is 2 years. After that, you then get an NMC PIN number as a qualified nurse. So that is how you basically transition from a carer to a nursing associate, then to a qualified nurse. But there's another twist to this. If you are a nursing associate and you want to become a qualified nurse straight away, then you will have to pay to do that. And that is where the catch is. So let's say you qualify as a nursing associate today and you want to go on to become a qualified nurse straight away. You need to go to university and pay over £9,000 per year for 2 years, obviously. Then you can become a qualified nurse that way. So what I recommend, for me personally, if you're already a nursing associate, you can as well just practice work in the role and find another employer, or your current employer, to fund you for that type of program if you're interested in becoming a nurse. Which means that in total, um, you know, becoming a nurse through this particular pathway is going to take you. So there's 2 years that you have to do initially, then you have to work for 2 years, and then you then do the top-up program. But obviously, if you want to just self-fund and become a nurse straight away, you don't want to bother about someone else funding you or paying for you to study, then you have to go through the traditional nursing pathway, which is basically you pay for yourself 3 years, you're a qualified nurse. You pay over £9,000 per year. If you are, a home student, if you're an international student, then you can expect to pay in excess of £17,000 per year to become a qualified nurse. I think the cheapest university that I know that offers nursing for international students, the cheapest rate that I know is over £13,000. But the average that most universities are charging is currently about 17,000, 18,000. Some charge in excess of £20,000. But obviously, again, it depends on your flexibility, where you live, what university accepts you, which one you want to attend, is going to obviously influence how much you're going to pay in terms of tuition fees. Another really important tip, because you've watched till now, which I appreciate that the video is 31 minutes into it now, but it's all information that is very useful. And so if you're keen, it's well worth it, because it's going to save you thousands of pounds. It's going to save you a lot of stress. It's going to save you a lot of questions. Or how do I do this? How can I progress? So it's well worth it, And so one other tip I'm going to say is that if you are on a visa, so you have a work visa, you can still be funded to do this nursing associate program. You don't need to have a British passport or indefinite leave to remain for you to be funded, because the employer that is funding you on those terms, so you're going to be considered just like any other worker to do it. But if you're going to university, if you have just come to the UK, for example, and you've got a visa and you're going to the university, then you will be considered as an international student if you're going by yourself. But if you're funded in this program by your employer, then you don't have to pay any tuition fees. So I don't want you thinking that, maybe because you're in the UK for maybe 2 years, 1 year, 6 months, or 3 years, then maybe you're not eligible. You are eligible, but the thing is, you need to find an employer that can fund you. And like I was saying, if you're part of my coaching program, Nursing Career Bootcamp, then obviously, we can look into your personal circumstances to be able to see what's best for you in terms of pathways, in terms of where you live, in terms of colleges, have you got the requirements, where can you do the functional skills, then we can go through that. Just because in the program, we have more time. We have weekly live sessions, which are just an opportunity for us to talk, for us to discuss things. But if you're not part of it, then I don't really get to know and understand your personal circumstances. So it's very difficult for me to advise. I don't like to give, I'd rather just do a generic open video like this that helps everybody and gives you the basic knowledge. But in terms of the specifics, to you will need to find out more information about that, because if we're not having that interaction, that one-to-one interaction, then it's obviously impossible for me to understand, where do you live and what do you do and all of that. So in that case, it's very difficult to give a more specific advice. So these are some of the things that you can think about. This pathway is so good. There's no rush if you've got children, or maybe you're a bit older and you're thinking, I don't want to go to the traditional university pathway. This is such a good opportunity for you to consider this particular pathway, so you can continue progressing. You can continue excelling, you can continue growing. Even if you don't want to become a nurse, that's fine. You can still go through this pathway, just so that you can get to band 4, because like I said, you can administer oral medications. The only thing you cannot do that is different from a nurse is I cannot administer IVs. And again, as a nursing associate, the NMC stresses on the fact that you're not there to substitute a nurse, but rather you're there to support that nursing role. So you're your own independent practitioner, which means that you're accountable. If you make mistakes, those are your mistakes. As of now, if you're a carer, for example, the nurse is accountable for the patients, not the carer. But if you become a nursing associate, now obviously you are accountable, but that accountability comes with better opportunities that you can grow, you can continue to progress, you can continue to excel. So yes, it is well worth it because it's all these baby steps that are going to lead you to whatever position you want. You may be watching this and you're thinking, I want to become a nurse lecturer, a nurse anesthetist, I want to become a doctor, I want to become a pharmacist, but you need to take the first step. You need to find, especially with pathways like this one that are funded, you need to keep an eye, make sure you're aware of what's going on, you're networking appropriately where you're working. Don't just go to work and go back home. Find out what are the opportunities. If you see people with uniforms that you don't recognize, speak to them and say, look, what do you do? I'm new to the trust. I'm not sure what this uniform is. Can you tell me what your role is? That's how you get to find information. And that's what I still do now. If I see somebody along the corridor walking past me, I'll say to them, look, what, this uniform, I haven't seen it before. What do you do? And I would ask them, what about your pay? How much do you earn? Can you progress? Have you got seniors? You need to be doing that. You need to be networking. Because the UK, for you to succeed, excel in this country, is all about networking. I know sometimes we feel that there's a lot of bias, and we can have many reasons why we think that the system is not supporting us to progress, but you can only do your best. You can only continue to do your own best to make sure that you have access to those opportunities that will enable you to grow, to thrive, to continue to excel, and to continue to feel fulfilled. And also, having to do this pathway where you don't have to pay to study, it is such an incredible blessing. So please, I want you to implement this. I want you to leave a comment in the comment section and say, Melvis, I will implement, because I'm going to be checking those comments from time to time and just saying, oh, what have you done? How far are you? But better still, if you join my private coaching program, then I can support you through that, because I can look into your own personal circumstances. We can have those one-to-one sessions where we'll really dissect the situation in which you are. Where are you living? Where is this pathway available? Because it is, if you look at the fact that you're going to be saving 9,000 per year by studying through this pathway, that is incredible. That is well worth it. Even if you had to move house or something, it is worth it because it's your career progression. It's a way to get into nursing, into the healthcare system without having to pay. And if you're already in the UK, you've got experience and you've been wanting to become a nurse, you can try this pathway. You can try this pathway. It's so worth it. If you're still out of the UK, yes, now you know about it. Share it with your friends so that you can help them, you can support them. They can know that actually they don't only have to end up as carers. There is more that they can do. There is a next stage. There is a next step up. And that is the point of all of this. The point is that, you keep on excelling, you keep on progressing. You keep on doing more because there's always more that can be done. And being a nursing associate is something that's going to give you that fulfillment. It's going to give you that gratification because you can be more clinical. Many people want to be more clinical, but they don't necessarily want to be a nurse. This is a role that really embodies that, you're a carer, you're a nurse, being in between. It really embodies all the values from both. So if you're already a carer with experience, then obviously this is a role that is going to blend so well within the nursing role. And you can have your own patients, you do your own documentation, you have your own caseload. Because like the NMC says, you're an independent practitioner, you are accountable for your own practice, and you're not directly answerable to a qualified nurse. But if you're on shift and your patient has IVs, you need to tell a qualified nurse to help you to administer those IVs. That's the main thing that you need to know about this role. If you're a nursing associate and you have a patient who's on any intravenous medication, you always need to get a qualified nurse to do that, because you're not allowed, as of today anyway, nursing associates are not allowed to do that. That is a major thing that differentiates nursing associates from qualified nurses in terms of clinical practice. because the aim of the role is that nursing associates can give more space. Having this role will enable nurses to take on more complex roles, in practice that would otherwise maybe even be done by doctors. Because like what I do now is a role that would traditionally be done by doctors, but as a senior nurse, I've had the training, and I'm still having the training, obviously, to be able to work as an advanced nurse practitioner. So it's a similar thing to the nursing associate role, where it's building you up, it's molding you, it's giving you access to that training, those opportunities that can help you to continue to excel, to continue to grow. So if you haven't subscribed to the channel, do hit subscribe, turn on that notification button, leave any comments in the comment section, like the video so that I know that you really enjoy content like this and I can do more. And if you want to recommend, obviously, any particular topics that you want me to talk about, please do so. I'll gladly do that, because I only really do videos for things that people are asking, because I don't want to do videos and just occupy space here on YouTube. So I can share this with your friends, your colleagues, your family, your loved ones, so that they are aware of this pathway. They can take advantage of this pathway and keep watching the videos. I've done videos about different career positions that are in the UK, and just all sorts of things like that, live in the UK, what you must know, childcare. So please check that out and keep watching. Thank you.